Hi everybody, Neil Kravitz here. I hope you're enjoying these daily clinical pearls. Yesterday, during case reviews with the incredible residents at Harvard, we spent a lot of time talking about one specific clinical pearl, and that pearl is the importance of mesial root tip on your lower first molars when you extract lower second premolars. A lot of times when you do a class 2 extraction pattern, upper 4s, lower 5s, or a class 1 extraction pattern, upper and lower 5s on a patient with moderate dental protrusion, you need to control the root angulation of the lower first molars. And oftentimes, if you fail to bond the bracket properly, or if you fail to get on the lower second molar, or if you're using undersized arch wires, the lower first molar will tip mesially, and you'll close the crown space. The lower 6 will touch the lower 4, but the root's dragging behind, so the tooth is dragging behind. And the problem with that is a periodontal problem. You have an area for vertical bone loss, food impaction, space immediately reopens, that tooth will upright, and patients will always complain about that gap reopening. And the problem is that we got a little lazy. You needed to control the root, not just the crown. The tooth is leaning forward and the feet are dragging behind, so to say. All right, so what do we do when we are extracting lower second premolars? Number one, I like to take my tubes and angulate them mesial downward. So I'm accentuating mesial root tip. A nice little trick here is if you're gonna band the teeth, seat the mesial side of the band last and overseat it a little bit. So I wanna really throw added mesial root tip. I actually think Wick Alexander in his bands actually included added mesial root tip in his band. So what I like to do is on my tubes, point the tubes downward mesially or overseat the bands mesially. You have to get on your second molars because if the wire ends at the 6, there's just simply not enough support with that terminal arch wire to upright the first molar. So get on the 7s, angulate the 6 tubes downward. You can always add a gable bend if you need to, but a lot of times just angulating the bracket does enough. And make sure after you close space that the roots have not been left behind. You want accentuated mesial root tip on your lower first molars when you extract lower second premolars. That will prevent space reopening and the creation of a periodontal defect. I hope you enjoyed this pearl. Let me know what you do when you extract lower second premolars. I'll see you guys tomorrow for another clinical pearl.